Hey, my friend Sam here. So I've been traveling a lot in the last month and a half. I've been getting a lot of different emails asking me some very specific questions. If I have a crushed pelvis, broken femur, broken ankle, and an arrow through the neck, what's your protocol? What do you recommend? I will admit I don't have decision trees in my head. I have decision bushes. Recently, I did a talk. I joined San Luis Ambulance. They were kind enough to invite me to have a chat with them, and I reviewed some of their protocols, their trauma protocols. My eyes glazed over in a few cases because there's one that says if your systolic blood pressure is less than 90, do this, and if it's higher than that, do something else. I don't even believe in blood pressure cuffs anymore. GCS, if it's below this, do this, or above that. Spinal motion restriction, TXA. There are so many things that I can't remember anymore. But on a qualitative level, these are things that I have in my head when taking care of patients. So am I safe or not safe? This is what I'm doing here is trying to explain my the decision bush of my brain. So am I safe or not safe? Is someone shooting at me or not? If I'm getting shot at, my decisions are going to be a lot different. Do I have one patient or many? Is this a mass casualty situation? That's very different care. Is it a focal bleed or is it multiple mangled limbs? Those are different. I can stop the vast majority of focal bleeding. But if it's a lot of bleeding in a lot of places, different pathway. Is my patient conscious or unconscious? If they're conscious, I will probably behave a little bit different. I'm going to be a little slower, a little quieter, kinder. I may use some lidocaine. In that case, I'm going to try to be a little nicer to that patient. If they're unconscious, well, you got to move a little quicker. Pulses or no pulses? Are they breathing or not breathing? Very different paths. Is it one injury or many injuries? How am I prioritizing all of those things? And then lastly, is what I'm doing kind of in the life improving category, or am I trying to save somebody's life? Those are different. If I'm on a soccer field, someone sprains their ankle, they're going to be just fine if I'm there or not. Their life will continue. But if I put a splint on them, well, maybe that'll improve their life a little bit. How to protocolize these things is hard. But I do feel that the more that gets written, the less likely it is to get read. And so I have no idea how to do this. How do you protocolize the art of medicine? How do you protocolize do unto others as you'd have done to you? It's very difficult. But I do wish that we enabled a little more, I guess, gray thinking in medicine.